been here since April. Is it more of an emergency now, and if so, why?
Well, we are seeing continued increases in the amount of influenza in Los Angeles County, and all our indicators suggest that. So, and we are now coming into the season when traditionally we see the most influenza, the late fall and winter. So this vaccine is coming in time. It's not any more of an emergency than it was. The difference is we now have a good preventative measure that people should avail themselves to that wasn't available before.
Any idea of what percentage, how protected you are once you get this vaccine? 100%?
Well, nothing's 100%, but in the healthy adults where these trials were done, at least in I think 18 to 64 years of age, the effective rates of response in developing antibodies was well above 90%. It was a slower percentage as you get older.
Do we know why so many of these vaccines, it's something like, I guess, 90% are going to the private providers and 10% to the public providers? What about all the uninsured people out there?
Well, when we say private providers, this vaccine, this FluMist. Well, let me start out. There are well over 3,000 providers that have ordered vaccine. We have been in charge of the allocation issue because this was FluMist. And it was sent primarily to the pediatricians and family practitioners that see a lot of kids because it's a very good option for healthy children, and also to the clinics. So it has also gone to the clinics that in fact sees kids, and it's gone to Kaiser for their internal distribution, for they see a lot of kids as well, about 20%. So it is not just going to the private providers, it is going to those that see low-income children as well.
Do you support the mandatory vaccination of healthcare workers?
Well, I don't know that mandatory vaccination of healthcare workers is going to be an effective strategy here. I think that I do strongly support all workers that are dealing with patients to get the vaccine as soon as it's available to them. And we haven't in the past seen the high take-up rate that we'd like to see. But I think we need to do a better job of convincing them and to get the people that they trust most to get the vaccine so that they see that it's very important for them to get. I think that, there are a lot of myths. And sometimes, some of those are shared by people in healthcare as well, and we need to disabuse people of those myths. Yes?
How much does it cost?
This vaccine, the FluMist, and the other are provided free to providers. So the vaccine may have an administration charge, but it would only be for administration. That will be based on the insurance plan that you have, and there's a large number of insurance plans, as we've all learned. But I don't expect that the administration charge would be very much. And the pharmacies as well. I don't know. I know that the vaccine they've had to pay for, some have been providing the other seasonal vaccine for $25, but they have to pay for the vaccine. In this case, they will be getting the vaccine free, so they will only be charging administration fee. So I would expect it would be less, but I don't know. At our clinics, for the uninsured and those that don't have another source of health care, we will be providing that free.
Can you open the box and show us?
Yes, I will. This is FluMist. This is the intranasal form that you simply put into the nose, and it is very effective. It is for healthy people between the ages of 2 and 49. It's approved for that group. It should not be taken by pregnant women, by those with respiratory problems, or underlying chronic conditions.
Can you just hold it up in each direction so each camera can get a shot of it?
Okay.
Dr. Fielding.
Adults age up to age 49 from age 2. So if you're between 6 months, and 24 months, you're pretty used to getting shots. A lot of immunizing agents, yes.
And is there a group of children that also should be getting the preservative-free one?
Whether anybody really needs to get thimerosal free is a very open question. There is no data that links thimerosal with autism, which is the claim of some and the concern of some.
Can you talk in the microphone?
Yeah. The thimerosal free. There's another batch that has only so small amount that you can barely measure it, and those together constitute a significant portion of the total. Coming from different manufacturers using only very slightly different methods. There is no link between thimerosal administration and autism. There have been a lot of different studies. I understand that people are concerned and pregnant women are concerned, and there is thimerosal-free vaccine for them and for children, but there is really no evidence that that makes a difference in terms of the concerns that people have voiced. There have been a number of studies, and they've all shown no connection.
And could you just one more time go through the numbers of when everything is going to arrive to the actual shot?
Starting next week, we will have also in Los Angeles County the injectable vaccine, and we expect next week to get about 200,000 total doses, most of that being injectable, and the week after we expect to get roughly 400,000 doses, so we will have well over 1 million doses by the end of this month.
In terms of administration, I know when you get the nasal, the FluMist, you have to wait 4 weeks in between the next dose if you're a child. If you're getting the seasonal and the H1N1 injectable, you can get them both, one at each side, and then how long do you wait for the second dose? Okay,
the same thing. Very, very good. If you're getting the injectable, you can get both the other seasonal and this seasonal in one in each arm, injectable. And then for a child 9 or under, you would have to wait at least 3 weeks to get the second shot for the H1N1. Okay? If you can get at the same time the H1N1 and by a FluMist, and you can get a shot for the seasonal at the same time, but you can't get 2 nasal spray administrations at the same time. Yes, I knew you'd be happy you asked.
With Dr. Fielding, with regard to the seasonal, I'm hearing at some hospitals they don't have enough for the staff, and it's a little confusing because they've been told they should get the seasonal before the H1N1.
Well, I don't think there's any magic about getting seasonal before H1N1. The reason it was recommended is because it was available sooner than the H1N1, and there have been some shortages of the. And I don't know if those have all been remedied. I understand that we also had a shortage because of some issues, and we've gotten some more of that vaccine. So I assume that we're not the only ones who have gotten that.
Will you be getting the H1N1 vaccine yourself?
I will be getting the H1N1 vaccine myself, and I will probably do it in front of anybody who wants to watch to try and help convince people. This is compromised. The cold chain has been compromised. We sacrifice this for the press.
So just to clarify, so out of the, you had said next week 200,000. When we were talking about the thimerosal-free ones, what is sort of the breakdown?
I don't have that exact breakdown.
Would it be like a small percentage? Or?
Well, it's roughly, I don't know, I'm going to ask Dr. Plow, but I think roughly a third of it is thimerosal-free. Is that about right? Yes. And another third roughly has just a tiny, tiny bit that's almost not measurable.
There have been 2 studies that came out that kind of fly in the face of CDC recommendations. The first one a while ago, the Canadian study saying if you got the seasonal flu, it makes you more prone to getting the swine flu. The second one was a Mexican study saying if you get the seasonal flu shot, you're probably protected against the swine flu. Any comments on those?
Well, the first one was not a published study, the Canadian one, and I don't think we understand that, but I don't know that there's any good rationale for that conclusion. The second study, the Mexican study, suggests that one of the components in the seasonal flu, which is H1N1, may have some cross-reactivity with this H1N1 variant, and so it might help you a little bit with protection. But again, I think there's nothing that we've seen that changes these recommendations that people should get the seasonal flu and now, when it's available, the H1N1, except that most of what we're seeing right now is H1N1. It is the predominant strain.
Do we know why is it, and this is kind of, well, anyway, I'll just ask it. Do we know why California is getting these, the FluMist and the vaccines now versus other states? Because I think a lot of people are seeing TV reports and so forth that have people in other states getting it and wondering why we're only getting it now.
I think this is all coming roughly at the same time, as I understand it. It's being sent out from central places on the Monday night after you order it, apparently for delivery by the middle of the week, unless you happen to be in rural Alaska. It may take a little longer, but it's being sent roughly at the same time. So some may get some a day ahead or a day later, depending upon the shipping, but because it has to be shipped with this cold chain. But no, it's all going at roughly the same time, and we are getting the vaccine in proportion to our population, as are every other state and locale.
If demand outstrips supply at your doctor's office, what would you recommend a person does next?
Wait, because the demand will not outstrip the supply. It just may be a temporal issue. So there's a couple of options. One, you could wait a week or two, and you could then go back. Again, a number of pharmacies have ordered this as well, so that's the second way that this is available for people whose usual provider doesn't have it. But I wouldn't call your provider now. I'd wait at least a week. When you call your provider, then say, okay, how much have you ordered? Do you think you'll have it in a week or two? If they say they don't have it yet. Okay. Very good. Thank you. Oh yeah, Okay, thank you all for being here. We'll keep you informed, and we hope to provide the schedule next week for the free clinics that we're going to have for the